These women mobilized across the country to build a game-changing platform that's helped the world combat COVID and understand it better. This tool is expanding to explore and tackle diseases like Alzheimer's, kidney and lung disease, all things that impact millions of people. Here's a sneak peek at the inspiring women and the treasure trove of information they created with health systems and hospitals across 49 states and an army of more than 4,000 volunteers. It all started when COVID was killing thousands of people each day. The world literally shut down, and then there was a phone call.
When I got the call, we were really at the very beginning of this whole mess. Most of us were terrified.
It's like, okay, we're home for a little bit, and then it turns out, okay, we're not going back, and then it's just that fear of like, how long is this going to last?
It's very quiet, almost eerily quiet, right? Because everybody was in the house because they weren't allowed to go outside.
We are panicked here, but we know the data can help us to address some of the questions.
It was all hands on deck, with data scientists across the country teaming up to find out as much information as possible, as soon as possible, about COVID.
12 to 16 hours a day. It was a lot of work.
Trying to bring a group together, you first have to establish that trust, and then you have to establish a working relationship. And that can take months, to establish that, sometimes, a year, depending on the number of collaborators. Well, this group had already established that trust and that, that working relationship.
And together they've synced data from more than 75 hospitals, billions of pieces of information, so that scientists can dive into it, explore, uncover trends, and find answers to the questions haunting people around the world. This was no easy task. You see, the data coming in from all of these places was dirty and cluttered. For example, there were more than 1,500 codes for diabetes alone. And not all the hospital systems defined it the same way. So this team had to clean up all of that data so that it spoke the same language.
So for example, in the clinical data where we have babies that weigh 100 pounds, and we know that those are incorrect values because babies don't weigh 100 pounds. And so we have algorithms that can repair data.
You have to use AI in order to predict or model out future or potential scenarios.
Here's how this super cool platform called N3C works and why these women are so geeked about it.
When you have a database with millions of patients, you're able to discover a lot of patterns that you can really do a lot of fun exploration. And then the other fun part is that there's cool ways of visualizing the data too.
It's like crowdsourcing science in a sense.
There's information on more than 16 million anonymous patients to explore. They've uncovered powerful discoveries that impact people's lives and public health decisions.
People need answers now. They can't wait for years. So they should care, because if they have a condition or disease and they want new medications or they want new treatments or they want to understand the disease, they need to know now.
In terms of a platform, N3C is to a data scientist what TikTok is to a 7th grader, right? It's, a place that they go to learn and create and solve problems, just as a 7th grader goes to learn some things and dance. If you're interested in solving puzzles and being creative, this is a great space to be in.
And at the end of the day, you and I may have a lot more in common with these unsung science heroes than you might think.
I love photography.
Recently gotten into hiking.
So I have a dog. I have a corgi named Esther.
Kayaking.
Love to cook and anything that relates to hunting, gathering, cooking, eating. Food. I like building furniture. And I also make wedding cakes.
And they have a message for the next generation of women in STEM.
We need more of us there, so we have representations.
A lot of what pushes people into getting a PhD is somebody saying, I see you doing this. I think you're capable. And when you see somebody who does the job see you that way, you start to believe in yourself a little more.
So if you're considering it, if you're wondering if it's not going to be a place where you feel comfortable, where you can find a community, I would say take the leap and do it, because I have found a community And I have found incredible women scientists who are doing super exciting work. And I can't wait to see more of that as time goes on.
So I hope that we can reach more women in science, especially the youth. Email a woman in science. So don't just wait for the opportunity to come to you. Take the opportunity for yourself and learn more. We're open community, and whatever we can do and learn and include more people, we're happy to do that.
Thank you so much for listening, and here's to inspiring the next generation.